Good morning. It's Richard Edelman from San Francisco. I'm joined by Kirsty Graham, who's our U.S. CEO from New York. So this morning, we're going to go through the Edelman Trust Barometer special report on trust and health. And let's just tell you where we were. We went to 16 countries in the last few weeks. We spoke to 15,000 people. More or less, we spanned the world. This is our third year of doing the health special reports. You recall we did this first during COVID, and we're here to report to you some very important findings. So before I get to the findings on health, I want to ground this in some important long-term trends on trust. The first one is the mass class divide on opinion, the elites versus the bottom quartile. We see that continuing to spread around the world. The second is that business is the most trusted institution in the world, far, far ahead of government, and also well ahead of media. And it's on the basis of competence and increasingly on ethics. The third is the battle for truth. We continue to find a decreased belief in media and the politicization of that. The fourth is now a new fear, which is innovation. People feel that innovation is going too quickly. So with that as context, let's get into the data from this special study. So there are four forces that are threatening health outcomes. The first is this fear about innovation. By 2 to 1, people believe that innovation is being managed poorly. Second, that politics is harming health. People actually believe that polarization has had a negative impact on their health. Third is dispersion of authority, which means that top-down used to be the way information was conveyed. Now, increasingly, we find that friends and family are just as important as scientists or medical experts about health. Last is self-guided health. We found in last year's report that the average person, 1 in 3, believe, I know as much as a doctor. Well, that trend has continued, folks. We're going to tell you more about this. So let me start out by talking to you about politics and misinformation destabilizing the health ecosystem. So specifically, institutions are less trusted on health. Every one of them declined this year. My employer, however, remains the most trusted. So trust is local. It is, in fact, important that your company speak to its own employees about health and its concerns. Trust in healthcare companies declined across all markets and also across all demographics. This peaked during COVID. It had a drop. It's recovered a bit. This year dropped again. The US, in fact, fell 11 points in healthcare companies to under 50% for the first time since COVID. Trust in media health reporting has plummeted over the last 5 years. This is deeply important because, again, it is across ideology, left, right, and center. It is across income groups, and it's across age groups. So again, not a single democracy in the West has over 40% trust in its media about health reporting. So we have to find other ways to get to people. Also, people, especially 18 to 34s, are making decisions based on social media and regretting those decisions. 55% say, I regret a health decision I made based on misinformation. What is that misinformation? Product advertising first, friends and family second, and then UGC, user-generated content third. This one shocks me. Literally, 4 in 10 young people only will see a doctor if that doctor agrees with him or her on politics. So I guess when I go to the doctor, I should ask, are you voting for Biden or Trump? But in any case, that's a joke, but it's not a joke. The extent of penetration of politics into the healthcare process cannot be overstated. It has infiltrated our thought process. Health fears have intensified, but look at the number one fear today, politicization of medical science. Again, a 13-point jump in this year alone. And again, it's across the demographics, meaning 18 all the way to 55 plus. Of course, affordability, another pandemic, and access continue to be high. But the rise of politics into health is not a good thing. And it's influenced people's attitudes towards technology. You'll recall from our January study that people are nervous about AI, that they felt that implementation is not understood, that they see everyone pushing towards AI, but they don't understand what it means for them. Well, again, we see huge rise in concerns about tech having a negative impact on healthcare. It's going to cost me more. I'm not going to be able to protect my health privacy. There are going to be unforeseen issues. In short, I have a huge question mark. The US is the leading country in this, up 14 points in 1 year. AI is not automatically something good. Acceptance of innovation in health is at stake, specifically around AI. The closer it is to me, the more concern I have. For instance, patient interaction, almost 1.5 to 1, I reject versus I embrace this innovation. On medical diagnosis, it's more 50-50, game to be played. So now, Kirsty, you take it from here.
What we saw in the start of the pandemic, if we can bring up the first slide, please, was the sense of patients becoming much more empowered. That's a good thing. But what we've realized in this research is it's not enough on its own. 2 in 3 people, 2 in 3 of our respondents said they feel empowered to manage their health. This is a good trend. What do we mean by empowerment? I confidently make decisions. I inform myself. I speak up with my primary care provider. I feel in charge of my health. This is a positive trend. What's interesting, though, is health empowerment is high across all ages and politics, but the area where there is a discrepancy is in income. Look at that third set of data. Low-income people are 13 points less likely to say they feel empowered about their health. So this speaks to the equity equation that we knew was laid bare in the course of COVID. I'm now going to introduce a concept of sort of 4 quadrants of why empowerment is not enough and why trust matters. If you think about this box on the right, we really want to get people to be both empowered and trusting in the healthcare system. Only 37% of our respondents are in that group. Let's call them invested. To the left of that, you see people who don't feel empowered, but trust the system. Let's call them differential. Then on the right-hand lower quadrant, you see people who feel empowered, but they don't trust the system. That's skeptical. And then this box on the lower left, who are disengaged, feel neither empowered nor trusting of the healthcare system. These mindsets are going to matter. Why does this matter so much? That holy grail of people feeling empowered and having trust leads to better healthcare outcomes. Even for those who have high trust in the system, but they don't feel empowered, look at the difference. There's 19 points difference in terms of people reporting good or better health if they feel empowered as well as the system. And what we realize in this research is that group of people who feel invested have a really important role to play. They also do other things. For example, they're far more likely to engage in preventative care. In fact, they are 10 points more likely to have an annual checkup than those who feel empowered but don't trust the system. Similarly, they're also more likely to follow public health guidelines. We asked around vaccination. There is a 14-point difference between those who both trust the system and feel empowered versus those who are more skeptical in terms of whether they had a vaccine and whether they've had the recommended boosters. So you're seeing a trend here around health behaviors. And to Richard's point about the innovation that's at stake, here's something else really interesting. When people feel both trusting and empowered in the system, they are far more likely to adopt innovation or to embrace it. So another interesting data point in here is the primacy of my doctor, of my provider. This has been a really interesting data point, but what you'll see in this section is that it's not just around the role the doctor plays in the diagnosis, but also the role the doctor is now playing in making sense of a much more complicated ecosystem. So since last year, we asked people who did they expect to play a large role in making sure I'm as healthy as I possibly can be. Look at this, myself. That is the highest response, +8 in terms of the year over year. Second is my primary care provider, up 10. And these two, which you think about relationships and proximity and trust being local, these are the only two that have increased. Look at those declines for institutions. My employer, business, and media all down by 9 points. And when we go into the doctor and we have the relationship with our primary care provider, they are but they are becoming more influential in health policy. In fact, doctors are more influential now than the National Health Authority or the Global Health Authority. In fact, they're twice as influential. So the role of my primary care provider has really increased year over year. And they're also the most trusted source for truth on health. They are the only one in this data set that have actually increased. Who do I trust to tell me the truth about health issues? My primary care provider, up 2. Everybody else in decline, and again, we see that decline in my CEO and journalists, down 10, as Richard alluded to. And what's interesting, when you think back to our 4 quadrants earlier, my provider is the only one that is trusted across each of those 4 mindsets. So whether you're invested in the system, skeptical or disengaged, every one of those groups trusts the primary care provider. Interestingly, my CEO is distrusted by 3 of those mindsets. And it's important because that relationship with trust and empowerment, those people are more likely also to vet health information. They're more likely to have a conversation with the primary care provider. They're going to talk to their doctor about what they've seen, and they're more likely to confirm that a health news story is true or verify it from multiple sources. So this point around having high trust and high empowerment and the impact it has on health outcomes is what I want you to take away from these slides. So if we lean into recognizing that empowerment of itself is not enough, how do we build that empowerment and also build greater trust at the same time? First of all, we need to address the barriers that we know are standing in the way. For 85% of people, when we asked about the gap between how they want to take care of themselves and how they actually do, I'm not surprised to say that both cost and access still feature as issues. But what I think is really interesting in here is this middle column. 58% of people now saying that one of the biggest barriers is information, whether it's contradictory, whether it's changing, whether there's a lack of information. But that has gone up 8 points. That's significant. And when we think about how do institutions build trust, what's really interesting here, doesn't matter whether you're a business, an NGO, or government, every single one of those institutions, the biggest way to build trust is to be a reliable source of trustworthy information. That is what moves the needle the most. For employers, there's another message as well. When we ask what is going to help you build trust in your employer on health issues, these are the ones that showed the biggest percentage movement. Make special accommodations for those with healthcare or caregiving needs. Have your CEO speak out to address public health issues relevant to employees. And thirdly, this point that we saw very prominently last year, CEOs are expected to model workplace behavior that is healthy, engaging, making sure they're taking PTO, avoiding overworking. This sense of the mental health burden that we started to see last year, utterly underscored by what's going to drive trust in your employees. And when we think about those 4 quadrants or 4 mindsets that we saw earlier, how do we reach them to think about getting more people into both empowered and high trust? There's a number of different levers. It's about combining expertise with accessibility. For those who already feel empowered and who trust the healthcare system, they're actually looking for an empathetic tone. For those who are less trusting, more skeptical, or don't feel empowered, there's a combination of things around show me the data, show me the credentials, and use language that I can understand. And when we think about those 4 quadrants, what is it specifically that's going to help? What are the strategies you need to employ to move more people into feeling empowered and trusting? If people don't feel empowered, they're deferential to the healthcare system, they're saying, convince me I'm an equal partner in managing my health. If they feel empowered, but they don't trust the system, show me that the health system is actually working for me. And for those who feel neither trust nor empowerment, improve my confidence and my know-how for managing my own health. And why is this so important? Because what we saw earlier, that group, or having more people both empowered and trusting, drives more than personal health outcomes. It drives system outcomes. These are the people who will vet information, they are influencing their peers, and they're advocating for innovation. So with that, I'm going to hand back to you, Richard, for our conclusions.
So I think we've shown you something important today. The first is to point out the obvious, which is this really terrible influence of politics on health and medical science. It's really one of the worst outcomes of COVID-19. We've got to empower the doctors to address these concerns and give them the time to make this important contribution to better health, which is not to be administrators, but to be information sources. Second, across the entire spectrum, we've got to fight this health information crisis. We're not going to be able to bring the media back to being a sole source of information because, unfortunately, it's now seen as politicized. It is a vital part of what we do to continue to talk to health reporters, but it's not sufficient. We also have to give information to NGOs. We have to work with government, and within the corporations themselves, we've got a really important channel, which is the employee newsletter. Quality information is a vital part of what we do, but as communicators, we've got to talk more broadly. Third, this idea of leveraging the provider influence, people want a partnership with their doctors, and they want good information to come from the docs. Lastly, we've got to use empowerment. This is a really positive development, but it's only one part of the axis. In Caitlin's brilliant column today, I'm quoted as saying, you know, it's like giving a teenager keys to the car without driver's ed. I mean, you know, we've got to have, trust but verify, in short. We want people to act on behalf of their own health, absolutely. But if we pair trust in the system with empowerment, we get 20 points better results on people's health. So again, let's make it easy for people to understand what we're talking about. Let's stop having doctors and health experts seen as elites. They need to be talking to people and information with very simple words that they can understand, and make them feel like partners in building up their own health. So, Court, with that, over to you.
Thank you, Richard. Good morning, good afternoon. I've really been looking forward to this panel today, and I'm so pleased to be joined by 4 really fantastic experts from 4 different parts of the healthcare community. And I think just building on what Richard and Kirsty have just shared, getting their perspective today on the data and what it really means for the communities that all 4 of these individuals reach and communicate with and help to provide health information to is going to be a really great conversation today. Let me start with some introductions so everyone knows who we have here with us today, and I'll start with Dr. Audrey Sue Cruz. Dr. Cruz has led such an impressive career. She's an internal medicine physician and an assistant professor of medicine. She's also a wellness advocate and a health and lifestyle blogger who has a social media platform that's really gained a global audience. And we're so thrilled when we talk about how we're talking about health information online and through social channels, as well as that physician intersection, to have her here with us. I will also say that Dr. Cruz worked during the pandemic in both the hospital and clinic setting, so has the perspective of a frontline healthcare worker, and also among many health professionals that really embrace telehealth to expand access to patients during the pandemic. So welcome.
Thank you so much.
Next, we have Caitlin Owens, who, as Richard just said, has helped to write a piece this morning on this in her role as the senior healthcare reporter at Axios, where she's covered health since 2016. I will say that Caitlin recently launched the Future of Healthcare Weekly newsletter, which is a great read, talking about trends really and where we're going in the future, looking at the healthcare sector across the board. She's also contributed in the past to Axios Vitals and Axio Pro Policy as well. Welcome, Caitlin.
Thank you so much for having me. And I'm looking forward to this conversation in which I'm clearly the least trusted person in the room.
Well, we'll dig into that and talk about how we're going to help to hopefully fix that and bring it back to a more balanced perspective. Welcome. Next, we have Erin Sexton. Erin is the Senior Director for External Relations at the Mayo Clinic. She focuses on the Mayo Clinic's reputation and engaging and fostering strong community relationships and partnerships, looking across audiences, including patients, employees at the Mayo Clinic, and local needs across the board. Before she came to the Mayo Clinic, she worked in a number of settings as well, both with a government relations background and other roles at organizations including Medtronic, the Minnesota Chamber of Congress, the Minnesota Chamber of Congress, yes, and the Minnesota Medical Association. Welcome, Erin.
Thanks. Great to be here today, Courtney.
And last, we have Gabriella Stern, who's the Director of Communications at the World Health Organization, where she's in charge of the WHO Global Communications Strategy, and she also serves as a spokesperson for the Director General. Gabby joined the WHO after 3 years at the Bill and Melinda Gates Foundation, where she was the Executive Director of Media and External Relations. And beyond that, she also has a career in media that we want to tap into today, given that she spent almost 25 years at the Wall Street Journal in a variety of roles. So I think really want to hear from you both in the perspective of what you're doing today at WHO, and I'm sure some of the findings on healthcare media, as Caitlin alluded to, speak to you as well. So welcome.
Thank you. Thank you so much for having me.
Well, as I said, I think the different perspectives you all have are going to lead to a really great conversation, digging into the data and really the different ways it really matters to different audiences that we're talking about. And Gabby, maybe I could start with you. And I think building on your background and the perspective you have on earned media, that role you have now that really has a global perspective. We know that the WHO has been and continues to have such a focused role on correcting health misinformation. Doing it at a massive global scale. And so as we're thinking about right now, the political conversation that Richard alluded to and moving into election season around the world, I wonder how you are seeing both misinformation broadly in health, but also this political element coming in. How are you seeing it inform the information and the questions that people have broadly across health issues?
So I'm going to start by how I see the situation and react a bit to what has been presented today. I actually think it's a good thing that people, ordinary people, normal people out there, our families, our friends, that they're actually skeptical. I actually think to not trust, but to know that you should verify is actually a very good instinct, given the barrage of information people get of a varying quality. So when you mentioned that WHO and my colleagues and I are trying to correct misinformation, actually one of the things we've learned over the past several years during the COVID pandemic is actually our job. We can't be there correcting from on high. We actually have to be with people and have a dialogue with them, so we actually understand what are they worried about, what are they concerned about. When they say they don't trust, what does it mean? When they say they do trust someone or an institution, what does that mean? And then work with them through different networks that we have, whether it's youth networks or church networks or health workforce organizations and so on, to actually find a way to address the misinformation and the disinformation, but not in a way where we're the school teachers correcting, but in a way that involves a journey with them. It sounds very theoretical and idealistic, but actually it has to be this way. Otherwise, you're just another nameless, faceless, technocratic individual organization speaking down at people. And the other thing I think that's really essential in the misinformation and disinformation ecosystem is learning from people. One of the biggest takeaways from COVID is that sometimes normal people, ordinary people, my relatives, yours, were ahead of experts in how they were dealing with the threat of the pandemic. Sometimes they took self-protective measures before the scientists caught up with them, because scientists and doctors have incredible expertise, but they also sometimes exist in ivory towers. They're not out in the world. They're not the key workers having to be at the D'Agostino supermarket at the cash register in the heart of the pandemic when people are coming in. They're not the delivery people who kept the economies going. So I think it has to be a partnership. It has to be a two-way street. And I actually think it's good to trust, don't trust automatically, do verify. It's the verification that we have to partner with people on. It's a natural instinct when you're unwell or your loved one is unwell. It's natural to want to take control of the situation and do your own research while also listening to various authorities. What's important is critical thinking to help people and partner with them to sift through the stuff that is or isn't fact-based and scientifically based and evidence-based. I hope that answers your question.
Oh, it does. And I really love your point on being on a journey and the partnering to really reach people where they are so that you can engage them and not just, as you said, it's not about just correcting, it's about really having that dialogue. If I could build on that with another question, you talked a little bit about some of the ways I think this is being really effectively done. You talked about tapping into youth networks and faith networks and others, but are there other ways, either approaches or very specific tactics you've seen that have been successful?
Yes, the other thing that's so important is to engage third-party voices. When there's a situation where your institution, and in my case, of course, it would be the World Health Organization, or the sector, when the sector is encouraging people to immunize their children against vaccine preventable diseases, the messaging, the dialogue cannot always and only be from the expected, the usual suspects, the WHOs or the CDCs. Really important to find credible partners, whether they are doctors or nurses or midwives or the healthcare providers who clearly have often have the trust of people, but also well-informed, beloved, either community figures that are, local celebrities, whether they're a pastor or a rabbi or a great sports star or a singer. Can't be anyone. It can't be frivolous. But we know that we all have beloved figures in the arts and in music and in science and in literature. And so one of the things we try to do is use our goodwill ambassadors and our champions and our friends to help us reach diverse audiences. So I think third-party voices are really important.
Oh, thank you. Dr. Cruz, maybe I could bring you in here too, because as we're just talking about this and then thinking about how we are really engaging people where they are, I think this is something that you are doing as you're engaging with people, both in social media and in the medical setting every day. I think with that and the trust in HCPs that we saw in the data, and then we combine that with some of the more concerning data, especially the 4 in 10 people who said that they regret making a health decision based on misinformation. And then we look at the younger generation, those 18 to 34-year-olds who reported that the #1 place they were finding misinformation was in user-generated content, including social media. So we have these sort of twin pressures here And as you're out there communicating with so much going on, online and off, how are you finding you can reach people to make sure you're providing that balanced information, the scientific and medical guidelines, but also responding in a way where they can really ask questions to you and feel that they can ask any question and won't be judged?
Absolutely. That's such a great question, especially these days where information is just so, there's such a there's a wealth of information. There's so many places to get information. And so I have a very unique and very amazing opportunity to be able to reach people in the social media setting as well as directly in my clinic. So currently what I do, I'm a primary care physician, mainly in the geriatric population. So I see patients every single day. And on my hobby, basically what I really like to do is I also like to blog about my lifestyle. I like to blog about health information, and I really like to reach the public in a way that can help and basically empower people to make positive decisions about their health. So I feel that what can really, shake the background noise is whenever I do make a video or a reel or let's say user generated content, me as a doctor, it's always important to tell people what my credentials are. So with every video that I make that may influence someone's healthcare or their decisions about their health, I will always mention I am a board certified internal medicine physician so that they can be aware of where this information is coming from. Anytime that I speak about data, I will always reference where this is coming from, what study this is from. And that's a new trend that I've noticed too on social media is a lot of physicians and a lot of healthcare providers who are trusted are now citing their resources, which I think is a really great thing. And so in social media, I believe that kind of being able to show people who you are and display your credentials. So I do in my social media profile, I'll say that I'm an MD, board certified internal medicine, so that they know, because these days anybody can label themselves as a health expert, and that can definitely have some negative impact because people will trust their word, and that may not be the best for them and the best for their health decisions. So in that aspect, that's mainly what I do. In the clinic aspect, what I like to do is, and when I speak with my patients, they are also very, very, empowered about their health. And so what I do is I act as a partner to help them make their decisions. I want them to verify with me what, they read out there in the media and also on various social media platforms, on the news and things like that, because it's important to work together as both a physician and them as a patient to really make the best decision for them. So I hope that answers your question.
Oh, it does. And I think hearing from someone who is doing this engagement every day is so interesting. One of the trends we've all been talking a lot about are sort of these generational differences, the similarities, but also the differences. And I wonder in your work, since you're both treating a more geriatric patient base, but then when you're online, we know it tends to skew to younger adults. Have you seen differences in questions they're asking you, whether it's questions or even sometimes when they might ask something that skews into potential misinformation that you need to help bring back? But what are you seeing in different ways across the different groups you reach?
Absolutely. So I noticed that in the younger groups, they are definitely more influenced by, and this is interesting because this was mentioned earlier, they are definitely influenced by what is out there. They are more empowered to take their health into their own hands. I noticed that in the more geriatric population, there's a lot of confusion. They read things from various sources. They don't know who to trust. And it's great when they come to me and they ask these questions, but I do know that when they're, just reading something, they can panic and they don't know what to do. They have multiple different sources of information, and they really just don't know who they can trust to accurately, present the data. So I've noticed that in the younger population, they are more empowered to seek out correct information and verify with sources, whereas in the older population that I treat, there's a lot of confusion in that sense. So, and I believe it could be a generational aspect because we kind of in the 18 to 34-year-old generation, we kind of did grow up with the internet. And whereas in the older geriatric population that I treat, this is new to them. They, the internet may have been more widespread in their, 50s, 60s, and now they're very much just trying to get used to and catch up. And so I do notice that there's a lot of more confusion in the older senior population.
That's such helpful perspective as we're thinking about reaching different audiences where they are, and sort of the tools and communication approaches that we need to use in the language, as Gabby was talking before too, how we're reaching people. So that's really
Absolutely.
helpful context. If we stick with the sort of focus on the healthcare professional, but move a bit to the health system side, Aaron, I want to bring you in here. One of the
Right.
things we've been talking about, obviously, is that healthcare providers are consistently one of the most trusted healthcare expert and voices when it comes to all kinds of health information. As we're looking across the board and we see the decline of trust in other arenas, we know that across all four of those mindsets that Kirsty spoke to, the HCP is the most trusted steward of information on healthcare. So as we think about that, I'm curious, one, your thoughts on both the decline in trust, but then that rise of the HCP from where you sit, and also within the community that you reach outside the doors of the Mayo Clinic. And also, how are you communicating with patients and really working within the communities to engage and get to some of the approaches that Gabby was talking about too, how we get into the community and use those third-party voices?
Yeah, thank you, Courtney. This is a great question. And one, I love that healthcare providers are really having a moment in this. So thanks for that. I think there's so much to unpack from what you've shared through this report. But I think a couple of things, one, it's great to see the trust in healthcare providers grow. But I think part of what's driving that is also some really unfortunate things that we're seeing within the environment. And Richard, you really touched on those really well. One, the politicization of healthcare. And so I think as more and more people are not trusting the sources that are put out there, they're really looking to that healthcare provider as that more neutral source in helping to navigate that information that's out there. Secondly, I think this has been alluded to, but that avalanche of healthcare information, there's so much out there. I sort of, jokingly say it's like when you do a mortgage, there's so much disclosure. There's no disclosure. There's so much information. It's hard to navigate it. And so how are healthcare providers helping to do that? And, I've had really personal experiences with this too. When you get some result and, of course, it's most of our natural instincts now to go right to Google. And then you look at the information you find, and then you call your healthcare provider and say, okay, this is what I'm seeing. Help me navigate this. And I think that's really, with all the information, which can be a great thing, somebody's got to help source and navigate that. And I think the healthcare provider is really in a great position to do that. And then I think to the other part of your question is, what else are patients looking for? What else are people looking for in terms of their healthcare? And really, it's one, your physical health, but it's also what are all those other factors influencing health? And how are we reaching people in different ways? And of course, this is something I'm particularly passionate about in my job. And while Mayo Clinic is really known for that serious and complex illness where people come to us from all over the country, all over the world, we are also a care provider in our communities and really have to look at how are we meeting those needs and meeting our patients in really different ways. And I think this is a great outcome of COVID, actually. I mean, nobody ever wants a pandemic, but if you're going to have one, let's learn from it and make ourselves better because of it, right? And I think that's one of the clear things that we saw is how do we reach our patients and communicate with them in new and different ways? And not everything is going to be the same for everyone. And so we've really looked at, one, how we got out when we were trying to get patients vaccinated, how we got out and talked to different populations. And that didn't necessarily mean it was just Mayo Clinic. That Mayo Clinic went out and we went and talked to the Hispanic population, or we went and talked to our East African population. We really had to partner with trusted voices within those communities. And I think that was something that was a huge learning for us. And not only did we partner with them, we didn't ask them to just help out of the goodness of their hearts. We really valued that. We provided grants to organizations, we provided information, and we really partnered. And I think that was a different approach. And it helped us be in Minnesota, for instance, we had the second highest vaccination rate in the state, and actually very little disparity between the populations who were vaccinated. And so I think, as we keep taking these outcomes, we can continue to learn from that. And we've looked at, one, we provide vaccines in schools. So we do a flu clinic every year with some of our healthcare partners in schools. We've helped to establish a 24/7 crisis center for mental health crises in our community. We've looked at how are we addressing things like affordable housing, things that I think all of us know contribute to and impact health, but maybe healthcare providers hadn't been engaged in those things in the ways that we maybe needed to be in the past. So how are we helping to contribute to better and more affordable housing stock? So I think those are the kind of things that we are now really looking at differently and being engaged in really meaningful ways. And I say that both from how our providers are getting out and providing care to homeless people through various partners that we have, or providing care in free clinics, but also how are we bringing resources to those organizations that are helping us do this work. And so I think that's something that that has been a great learning from us. And what I think what the report is telling us, what the Trust Barometer is telling us, is not only do we need to continue to do this, we need to do more of it, and make sure that we're getting our voices out there in meaningful ways. And then the last thing I would just say is I do think we have to look at how we're using our channels to cut through the clutter. There's so much out there, and I think Mayo Clinic as an organization that has a long history of trust, which is wonderful, and a reputation for that. How are we using our channels to bring that information out and help to cut through that clutter too, and extending our providers' voices from the exam rooms out into our communities and the country and the world for that matter. So we're utilizing things like our news network that has content available to the public, available to journalism, high quality video that can be used and help to share that across. We're using our social channels, we're using our provider voices, and we're using our patient voices to be able to share those messages too. And so I think we see ourselves having a role in helping to break through that clutter and really bringing that trusted information out into the public. So I'll stop there. I'm not even sure I touched on all of those pieces of the question, so if I missed one, please let me know. But a great question. Thanks, Courtney.
Well, I think you really brought to life practically how on the ground you're activating on a lot of the things we've already talked about this morning in terms of how are we reaching, how are we bringing in other voices, how are you meeting people where they are in ways we can really help them, but also the data that we saw that showed that while we're seeing this, especially this empowerment data, while it's very consistent globally and across age and politics, we know that the income gap is one of the places there that we really need to address. And so I think a lot of the approaches you talked about that Mayo Clinic, and I'm sure others are taking a focus on, is really looking at ways to close that. So when you talked about some of the outcomes where you're not seeing that demographic split, and maybe you're looking to close the gap, there's a lot of really interesting pieces there I think we can learn from. I do want to just say we're getting some great questions in the chat. So for anyone there in the audience, if you have questions, please do put them into the chat and we'll get to them. And actually one of the ones I want to get to next, Caitlin, I want to bring you in here. So obviously, as we're thinking about sort of the media landscape and given your role as not just a reporter, but a healthcare reporter, and we saw that the data, I mean, it's troubling data to see the decline in trust in health media. And when we talk about this really strong intersection we're seeing between politics and health coming together, I really want to get your perspective, because we believe that healthcare reporting is such an important part of how we and the organizations we work with communicate. We know that you focused on a balanced perspective and are putting it out there. And I think sort of how you see the distrust that we're seeing, like what do you think is sort of behind that? And also, what are the things that you are doing and you would encourage others in your profession to be doing to help counterbalance at least the perception that there is bias sitting in healthcare media reporting? I'd love your perspectives on that.
Yeah, so I think that at first when I saw these results, it was disheartening, right? It's it's what I spend my time doing, and I am the least trusted person in the room earlier. But when you really think about it, or when I really thought about it, this isn't surprising at all, right? And it's, it's at least on par with, and probably actually better than trust in the media as a whole, regardless of the topic. So I think this question and this issue is really about trust in the media generally. And, if I had to kind of offer my analysis of what changed, it's that I think healthcare used to be separated from politics. And since the pandemic and in the years since, it's only become more and more entwined. And so, I think the media has long been associated with politics, right? Like what your political views are informs where you get your news, where you get your information. And I think that healthcare, unfortunately, has just been folded right into that. And so I guess the big question becomes like, how do you disentangle all of this? But I think that's also juxtaposed against an even bigger question, which is something that I think, being at Axios at a startup from 2016 on, it's just, how does the media become more trusted in general? Like, how do we break through these echo chambers and convince people that we are trustworthy voices, and our individual organization is a trustworthy voice when, others may not be, or others may be telling them the opposite of what they want to hear or telling them exactly what they want to hear. So I think that this is obviously a healthcare problem, but I think it's also a much bigger media problem. And then when you throw in social media, I think today, if I went on the internet, I could probably find something that supports any opinion that I have, right? And so I think that we're also competing against that. It's not just other media voices who might have a different take or may not be as trustworthy as us. It's also Joe Schmo on Facebook posted that, something completely inaccurate. I can pick up that today and say, oh, I thought that too, must be true.
I think you're so right. And I would say another place that I think of, especially for you thinking about the future of health, is how are we getting information out about innovations and advancements in medicine and science? And so as you're covering those areas, and we saw some of the data looking at distrust in AI, for example, in different parts of health, but then the positive data points that showed that those invested individuals that are empowered and have high trust, they do believe and want to talk about innovation, and they will most likely be advocates and potentially early adopters if their physician recommends something to them in terms of those innovations. How are you seeing both coverage of those issues and maybe even the questions that you're getting as you're thinking about how you put things out and questions, especially about AI and health?
This is I think the first thing I would say is if you want to be trusted, be trustworthy, right? Like when we're talking about AI, there are nefarious ways of using it, including in healthcare. One of the first things that comes to mind is if it's used in a discriminatory way or in a way of preventing access to care or a way that's used to maximize profits that, at best has no impact on patients or at worst impacts them poorly. Now, of course, there are so many different good things that could come from this new technology. I think one that we've hit on this call and talked about in the process leading up to it is if it gets rid of some of the administrative burden on providers, right, and frees up doctors' time. Mm-hmm. So I think that, healthcare companies, right, like their trust is plummeting. I think that it starts there. I think that you have to, people aren't stupid half the time, right? Like it's not just that they're on Facebook and gathering all this stuff. It's that they have a real reason to be skeptical. And, I think across the field, we should all be skeptical of how technology is going to be used, and it deserves to be scrutinized. That being said, I think it's on communicators, whether that's media like me or everyone on this call. I think it's on ourselves to be straightforward. I think something that we did poorly as a society, or at least as, the healthcare institutions writ large during COVID, is we weren't good at saying what we didn't know and talking about uncertainty. And sometimes that's the most honest thing to say, right? Keeping it clinical, at least in my profession, and just saying the facts and not offering my 2 cents is important. But, and I think all of this is working. Sometimes I think that it's the opposite. We've been doing the opposite of a lot of these things, right? And it's all working together to sow more distrust.
I think you're right. I think you're right. I want to go to a question from the audience. We have a great question that came in related to caregiving. And the question is, what do you all see as the role of the caregiver in building trust, and as well as engagement and then health outcomes? Knowing especially that personal relationships are so important when it comes to health information. I open it up to the group if anybody wants to jump in on that one. I think it's a really great point. And Gabby, let me start with you.
I'm not a caregiver, so Audrey Sue should speak, but I do want to talk about the health workforce. Everyone from physician to nurse to midwife to the elder care worker to the person who cares for your loved one in their home or in an institution. they need to be supported, and globally. There are shortages of these workforce cohorts. WHO has statistics that we work on with different academic institutions showing really massive shortages of nurses, midwives, and so on. So the countries, economies, private sector, public sector need to be nurturing new generations of health and care workers all the time. So that especially, well, not especially, but there are different gaps. In aging societies, you need people to take care of the increasingly elderly cohort. But the other thing I wanted to talk about is, it's good that people trust their healthcare provider, but in so many places, people don't have reliable, consistent access to a physician or a nurse, a clinic. There are, Erin, you mentioned the East African community in Minneapolis, and I was reminded that during COVID in East Africa and many parts of the African continent, people did not have access to the new vaccines when people in affluent countries did. And similarly, other innovations, whether it was Paxlovid, the therapeutic, or diagnostics. So part of the trust deficit in some countries and in lower income communities in rich countries has to do with inconsistent or complete lack of access to the same life-saving tools that people who are more affluent can just count on. And it's one reason why countries need to invest in health and see health not as a cost, but it's actually investing. When you invest in your health system, you're investing in your economy, you're investing in future generations. You're really investing in the well-being of your entire populations.
Absolutely. And I think to take that and then bring it back to some of the other themes that are showing up in the chat from some of the questions, I think one question is, given this important role of the healthcare provider and those access gaps, Gabby, that you just mentioned, how do we help people that don't have that relationship today with a provider, whether it's because of where they live, the shortage in the area, or they just don't know where to turn? I wonder, Dr. Cruz, if you have thoughts on, to start, where do we go in terms of helping people to make sure they can reach out to the right kinds of health experts to talk to?
Absolutely. And that's such a great question when it comes to, discussing access and, reliable health information. And I think, these days, of course, technology can be a good or bad thing. So can AI. But I do think that the great thing about technology these days is access to telemedicine. And so that's kind of one great solution is that many people, I can't say globally, but, within certain regions can have access to internet. And I hope that is, something that people can realize, that with access to internet, you have access to a physician. The great thing, I think, since COVID is that telehealth is now more widely accepted. And, it doesn't matter where you are. If you're, let's say, in a very rural part of your country, if you have access to the internet, you do have access to a physician. And I think that's something that many people should be able to hopefully be aware of. Telemedicine is great. There's so many different platforms and availability, and board certified physicians that need to be accredited and credentialed in order to be able to provide people with this information. But I think that's one great thing about where technology is headed these days, is we can, even through a Zoom call or a FaceTime, patients can speak with a trusted provider, and they don't have to take off work or sit in a waiting room for 2 hours if they just have a simple question. I think that's a really great thing, is that telemedicine is just widely now more accepted than it was prior to the pandemic. And that is one positive I believe I've seen in healthcare that has happened since the pandemic.
I would build on that too. So the gap in having access to healthcare professionals, there's also sort of this gap in understanding for many people really about how science and medicine work. The idea that science evolves and we have to help people come along for that journey as recommendations change. And so we have a couple questions that have come in really asking about how do we do a better job of that, of helping people to understand that this is the expected path, and we've got to bring them with us to help them understand when the data or the science evolves. Gabby, I don't know, to start with you, is there anything that sits sort of in your mind of where that would go, and then welcome others to chime in as well?
Yeah, I mean, that one of the biggest lessons that I learned early in COVID was, authorities and experts in a crisis, they want to say definitive things because they know that millions of people around the world are looking to them for answers. And they have to, it's very challenging if you're a physician or a public health expert or scientist. Your instinct is to want to say, this is how it is, do that, to be extremely definitive. And when actually you have to say to your audiences, we don't know everything yet. Our knowledge is evolving. Right now, here's our current thinking, and you might want to consider taking these precautions. That message, the evolutionary, the latter message is subtle. It's not conducive to sound bites and headlines, but it's actually more helpful, and it allows the message to evolve as the scientific knowledge develops. And so my team and I have really worked hard to find ways to communicate about how science works and how our knowledge evolves, but to try to get it, to make it compelling through stories or through different kinds of social media products.
And if I could jump in, it was really interesting covering this during the pandemic, watching public health experts and communicators try to figure out how much information to give the public. Because I think, as a reporter, my understanding from the onset was that, the public health community thought that the best thing to do was to give people concrete information and concrete steps to follow. They started to find out that that was not the best thing, especially as information was evolving. And so then it was just kind of this discussion of, well, how much information do we give people? Because, what's the line between being honest and transparent and just confusing them and giving them nothing usable? And so I'm sure Gabby would know much more than me about where everyone's landed on that. But as I was thinking about this as she was talking, like this sense of empowerment, I think that people felt that, I think maybe it was a real-time lesson in that during COVID where people, they just weren't taking things blindly. They didn't want to be treated as, I don't know, a better word than sheep, right? Like to be told what to do and not really given the full explanation of why. And so maybe this survey is really hitting on something that was part of the big problem with communication during COVID. And the problem wasn't with people, it was just with institutions realizing where the public was at.
There's one more thing, absolutely. There's one more thing, which is the fast pace of digital platforms also makes it hard for your audiences, people, to digest subtleties. And we found that when we were talking about the new vaccines, when they were coming online in mostly in 2021, started in late 20 in England, we would explain that the vaccines don't prevent COVID, they reduce severe symptoms. And people took away that, oh, this is a vaccine, it's like the vaccine against measles or something it'll prevent. And it was hard to kind of get that it will reduce severity of symptoms, reduce hospitalizations, take pressure off of health systems. And people really wanted to hear that it was preventative, right? And so that, I don't think any of us have really cracked the code for how do you use these very cluttered, fast-paced, engaging with social media or even a live press conference. It's like speed dating. How do you communicate fast but nuanced? It's it's tough. And I would love to I'd love it if people would research how, A/B, how do you do that?
Well, I think that's a great point to end on, because I think that opens up the door for another conversation and perhaps some research we can do next year in our next report to come. So I want to thank all of you for joining us today. I so appreciated this conversation. Let me hand it back to Richard to close us out. Thank you all.
that was a super conversation. I want to leave you with 2 or 3 thoughts. The first is an analogy from a playground, which is a seesaw. Usually kids have fun on a seesaw if you have equal weight. We need to try to have trust and empowerment be equal weighted. And then kids are going to have more fun. Second thought, trust is local. My MD, my company, influencers, pastors, think about the, in a sense, dispersion of authority, but also the idea that trust is close to the person getting the information. Next, information quality. Caitlin's correct. The media is vital for health messages, but not sufficient. We've also got to talk to business, to government, to NGOs, use all channels possible to get quality information as Mayo Clinic is. Next point, listen to people and make sure that you speak to them in a way that is simple, understandable, etc. Lastly, on the separation of healthcare and politics, let's try to put a line under what happened in COVID-19. We can't constantly be looking back over our shoulder if we want to be running forward. We have to acknowledge what we've learned from COVID about this fast but nuanced information and go forward. So in a certain way, I feel somewhat like the principal to the graduating class. I want to inspire you to do great things in the next year. It could not be more important. Trust drives growth and action earns trust. The next big trust report, which is coming out in June, which I encourage all of you to come listen to, is we're in the field right now on brands and politics and how a brand has shorter yellow lines, closer yellow lines. 12 countries ranging from Indonesia and Malaysia to Brazil, to the US, to the UK, across 8 different industries, and what things brands can and should speak up about. So thank you all for participating. Huge heart for my Trust Institute team and for Courtney and Kirsty for driving this great research. Thanks all.